Hi, I'm Kelly again, and this is my reporting back after my 2-week post-op appointment with my doctor. I wish I could say things are going well, but actually they're quite a hot mess. Um, and yeah, they're a hot mess. First, though, I want to give a shout out to the coworkers of my husband. They have been just amazing. When he broke his collarbone, they had set up for meals and extensive meals, and they did that again for us to some degree again after just very little time lapse, and we were set up with meals again, and it is just so appreciated. And it is the most amazing company I've ever seen as far as just co-workers, just brotherhood and sisterhood between the co-workers and just the general atmosphere of the workplace. So a shout out to my husband's co-workers and all that they've done for us as far as meals and things like that. It is so appreciated. So I went in and the x-rays were not, well, they were very concerning to my doctor. First of all, I had to report to him that there was a lot of pain on the right side. I have what I felt was a nerve compression, a pinched nerve radiating down. You could feel the knot, and it was a long knot. And I've had these before. I've had these for many years. And so this was very concerning. They took the x-ray, and the best way, and of course the pictures are going to be shown throughout this video, but the best comparison I can use is the old school kind of comic piece where the baker is holding the cake, and the cake is very steady at the bottom, and the cake is toppling and waving at the top. And that's basically what my neck is doing. It's bowing at the top. When they got in there, they found out that C5 and C6 and C6 and C7 were fully herniated. And C3 to C4, C4 to C5 were bulging. Now, it was my understanding that they were going to do a discectomy on C4 to C5 as well as C5 to C6, C6 to C7, that they were going to do a discectomy on 3 of them. But the choice was made to only do the discectomy on 2. And when my doctor saw the x-rays, he had a look of concern on his face. I've seen expressions on doctors over the last 20 years. I've seen a lot of doctors between California and here in Virginia, and I've seen fear once, and that was when I was in an emergency room at 3 a.m. with a perforated ulcer with peritonitis. I saw fear, and that doctor saved my life. When I was in my orthopedic surgeon's office the other day, I saw a very concerned doctor, and he may have not known that I could read that, but I could read it. And the pain I'm experiencing, it's just wrong. And at this point, I really wish I hadn't had the surgery. I'm a mess, and I'm just being honest right now. I know it's early days, but I ended up having to have a trigger point injection, another steroid shot. And besides being able to bench press a Buick, speak fluent Russian, among other things, I have had enough steroid shots in the last 1 to 2 years that God only knows what this is doing to me. And one of the reasons I had this surgery was to be able to stop these steroid shots, stop these Toradol shots. And there I was, 2 weeks after surgery, having a steroid shot, which was good because at least it was going to help stop some of the pain, which intermittently since 2 days ago, I'm having the same searing, gnawing, horrible pain that only a nerve compression can feel. So I'm supposed to wait 4 more weeks for an MRI? No, I don't think I can. I'm done. I have been doing this pain thing for 20 years. It's ridiculous. Something's wrong. Something's not right. So I need to figure out what it is. I'm frustrated. I'm tired. I have been sleeping sitting straight up with this neck brace on. You know, it's bad enough to not be able to sleep in a bed. But at least without a neck brace, you know, you can kind of get creative. I can't even sleep in the recliner at this point. And I'm not trying to sound like a whiny kid. I've just been a chronic pain patient now for 20 years, and it's been very progressive. And I had this surgery after a few years of careful consideration and a lot of soul searching and a lot of weighing what was, you know, weighing the ups and the downs, the pros and the cons. So my best advice is, if your neck is bad, go to the larger cities. I really would advise that. Really weigh in, at least before, you know, the pain was kind of, you know, you knew kind of what to expect and this and that. I'm fed up. It's all I can do to not just fold up in a ball and just give up. On the other end, though, I do have a good piece of advice on ways, if you are getting out and you don't want to just have this thing sticking out, and it is winter, or it's getting to winter, one good way to hide the brace for us girls: scarves. Yay! They're trendy, they're cute. So it's a really good way. At least we get a positive little twist on all this. And trust me, I'm not trying to sound whiny or cry. I'm just being truthful. So, the scarf. And tonight, when I was trying to get past people in the store, I said, I'm sorry, I can't move my cart to the side. I've had spine surgery. And I said, see? And she's like, oh, yes, I see. So, it is actually good enough that it's not really noticeable unless they really look. So you got the whole, you know, it's a fashion statement, and it's warm, and it covers the collar. So at least a good piece of advice here for those who are wanting to get out with their brace on and not just have the thing sticking out. So I will check back in a few days, and if I've got any good news, different news, better news, hopefully, and we'll see how it's going. But right now, it's a hot mess, and it's miserable. Have a great day. Oh, and if anybody's been in my situation after surgery, I would gladly love to hear from you. I would really appreciate it. Thank you. Blessings to all.